Thank you so much for joining us on the Urban Agenda. In the next 30 minutes, we will focus on something that's been on all our minds. India's public healthcare system and, more importantly, the safety of our doctors. Now, the tragic incident in Kolkata where a doctor was raped and murdered at the RG hospital has shocked us all. And it's not just about the horrific crime, it highlights a bigger issue. Are we doing enough to protect the very people we rely on in our most vulnerable moments? In this episode, we will dig into the state of hospitals and healthcare in urban India and discuss whether the recent proposals from the Health Ministry and Supreme Court directives are enough to bring any meaningful change. Joining me, Dr RV Asokan. He's the President, Indian Medical Association. We also have with us Sabine Kapasi, who's a public health expert associated with the United Nations. Thank you so much, both of you, for joining me. And you know, I'm just wondering, and the nation is wondering, for the first time we've seen countrywide strikes and protests from doctors to ensure that their voices are heard and necessary reforms are implemented. But even with all of the headlines, every day there are WhatsApp videos emerging of relatives going after medical staff across the country, even now. Now, you know, Dr. Asokan, IMA's own study a few years ago revealed that 75% of doctors in India have faced abuse, and violence in hospitals, the numbers are staggering. 90% of doctors report that relatives of patients do engage in verbal or physical assaults, especially during emergencies. To me, it seems, and of course, everybody can see that the system is badly broken. So I'm just going to come to you, Dr. Asokan, and ask you, you've met the health minister, you have been doing multiple meetings as the head of IMA. What changes do you think is going to happen this time around?
We are hopeful of the changes since the Supreme Court has intervened in a very qualitative way and addressed at least two issues. One of the main issues that they have taken up is the safety and security in the hospital. The second one is the working condition and the living condition of the residents. So safety and security they have given to the task force, and we would have liked to be in the task force, but the Supreme Court was kind enough to say that IMA's viewpoints should be heard by the task force. So we are working on a document wherein we will be able to present our viewpoints on the security. We, for record's sake, we had said that something like an airport, there has to be a security profile in hospitals. We are also sensitive. We should not harass the patients. It should be patient friendly and also culturally sensitive because our families tend to live or come up with the patients. So this is what we are expecting now out of the task force.
The 25% extra money, Dr. Asokan, which is now the health ministry said that we are going to look at review every hospital. In fact, AIIMS Delhi, today's news is also reviewing its own security measures and making sure that it's beefed up. This 25% number, this is my big question to you. I mean, what is this number and what will it really bring on? Because, you know, I also noticed that IMA has brought this issue up, that the healthcare expenditure in this country is as low as 1.2%. The Lancet report says we have an economic survey which says that it's gone up to 1.9%, but compared to UK, Canada, even Brazil and South Africa, we are at a very dismal low number. So isn't this a larger issue of what we are really putting towards public health, especially large medical colleges, sir?
There is certainly issue. IMA's in the health manifesto, our first demand is increase the input into the investment into the health. That's our first demand during the elections. 1.1% is a miserable investment by the state governments. 3.9% is the total health expenditure of the country, both in private sector and in government sector. 1.1 comes from governments. Rest 2.8 comes from the private sector.
Right.
It's 1.1 comes around 3.65 lakh crores. Out of this, normally the state governments give two-thirds and the union government gives one-third out of the government share. So what has been provided in the current union budget is less than 90,000 crores, which has become one-fourth. What was one-third of the contribution into the state,
So it's
now it
shrinking.
has actually become one. It
So
is
yeah,
shrinking. It has
as
already.
you know, economy is growing, but the expenditure on healthcare infrastructure is shrinking, and despite the government's own report saying that 80% of medical establishments do not meet the standards, whether it's on infrastructure, whether it's on medical staffing, whether it's on medicines available. All right, Dr. Asokan, I'm going to come back to you. Let me get Dr. Kapasi. You've experienced so much of what people are protesting about today as a doctor, both while studying, doing your undergraduation, and of course as a practicing doctor as well. Now, there is also a question of the fact that only 29% of medical graduates are women, and women hold just about 18% of leadership roles in healthcare. And of course, POSH, prevention of sexual harassment. It took an incident of this horrific a nature for us to wake up to the fact that POSH, forget about implementing, is probably not even understood or even spoken about in India's public healthcare and hospital system.
Manisha, thank you so much for having me. First, let us speak about the presence of women in the healthcare industry. So, I'd like to correct you on one point. In fact, healthcare is one of the very few industries where women actually are much higher in number. If you look at it, healthcare is not just about excellence in health industry, but it's also about the care component of it. It's about the it's about connecting and empathy to the patient and the family. And I believe that women are inherently more empathetic and caring in that
So
nature.
I,
And
I
that is
agree. I probably took a very narrow universe of
so,
doctors,
no,
but
so the
healthcare
point
is
is
much
that
larger.
larger healthcare industry has always had more women in it, and they have done very well for it. That being said, the question about POSH and security is also not new. I mean, we did this exercise with National Commission of Women a year ago, and unfortunately, we were able to highlight 365 cases of sexual abuse within women in the national discourse. And a lot of them also stem from the healthcare profession. We have to understand that healthcare is a profession which directly connects to people. The number of people we as doctors and as healthcare professionals interact with every day is far more, is hundreds of people every day. Is far more than the number of people that any other profession directly interacts with.
Right.
And secondly, most of these people come with a lot of angst, pain, and in a state of extreme discomfort, whether it is for their own comfort or their family members. So they are in a state of heightened emotion. So in that case, security becomes a peculiar concern, especially for women in this area of the workforce, because they face the burnt of that emotion. How much ever trained we are, how much ever experienced we are in the area of caregiving and empathy, it is never enough. So a systemic support towards security is extremely necessary. And coming back to the POSH issue, it is quite tricky that not just in healthcare, everywhere else, since the Me Too movement was at its peak, POSH has been almost completely forgotten. And there is a whole bias that, once you go into the area of POSH complaint, who are you going to report to? Is there really a sympathetic ear at the other end? And is it going to disrupt your day-to-day life? So these are the questions that have very little in form of answers, and we really do need to crystallize those infrastructure within organizations as well.
So here's my question, Dr. Kapasi. We're talking about more legislation. We're talking about a 9-member task force to look at what are the missing aspects of large hospital security issues and then, beef it up. In terms of legislations, we do have legislations already protecting medical professionals. 26 states have them. We also made them a bit stronger during COVID. But whenever there's an incident, and a large incident, right, the police which steps in, somehow there is a huge gap between the legislation and what you really see at ground. How do we strengthen that? I mean, in terms of, if you were to give us some opinions on how do we make all of those legislations actually get practiced on ground. It's a very, very large profession, very spread out.
More than legislation, because health, as you mentioned and we had discussed earlier as well, healthcare is not just doctors, it's nurses, it's people within the healthcare ecosystem who are working in the field work. So the frontline health workers, almost exclusively women, all of them. And the thing is, it's not just about legislation being implemented, it's about the feeling of security, which has been largely absent. So I believe that there's a two-prong approach. There is an approach where we do need a larger area of monitoring. I believe the AIMS report very recently mentioned that they are going to have CCTV cameras with enough and more, AI backend for monitoring those cameras. Because even if there are cameras, what's the use of it if no one is really looking at the feed at the back end? So we do need a good support system around that, not just within hospitals, but also within the frontline task forces that are visiting villages and giving care, visiting our homes, even in the urban setup and delivering care. We had the same workforce being used and optimized during COVID, which is why we are all safe and secure today. So that is one bit of it. But the second and the larger bit is the education and the respect that we have always afforded women in the society. So being a woman in the workforce, I'm sure both you and I have faced similar issues, and millions of women who are entering the workforce after us, we do owe a due to them to make it a safer workplace to function and be it healthcare or otherwise. So, an attitude of sympathy and attitude of care is very, very necessary. So we have to work on both these prongs. One is legislative and other definitely being a cultural shift in attitude.
I think a cultural shift is very, very critical here. You can put n number of CCTV cameras, have legislations, put money behind the safety and security system, Dr. Asokan. But whenever I've taken up this issue of violence against women in any form, especially at the workplace, which is supposed to be the safest place, actually, your home and your workspace is a spaces where you must go in with confidence and live with security. The answer which I get from most people, and it is the right answer, that you need a serious cultural shift. Do you believe, as I may, just the whole sensitization of all the medical staff and the graduates and the doctors and the nurses, everybody has to be done on how do they need to treat women in hospitals and in the medical fraternity? Isn't that a very big thing that IMA should take up?
I think this sensitivity, if you look at, the profession has it inherently. The way that we treat our women doctors as equals, gender neutral. The word doctor itself is gender neutral. And the space that we give them inside the profession is perhaps indicative of the sensitivity of the profession. What we are here looking at is not only the sensitivity to the women here, but the security in the hospitals is overall is the relationship between the medical profession and the healthcare personnel with the community.
Dr. Sabine, do you
May
have
I
something to
add
add?
just one thing? I think, as Doctor mentioned, along with legal approach to it, there needs to be a hard technology support to it. A couple of years ago, we had a pilot run in Haryana where FIRs were actually registered on blockchain so that no changes within the domain were possible. I think there were some others that NPCI did within those domains as well, where within the law and order areas there was tons of security measures which were technology led, which were embedded. I think these are the initiatives that we need now. We need them today. Like we are looking at AI-based CCTV cameras to aid the police workforce. So once we have legislature in place, we will require this technology to support the police and other well-meaning workforce.
I'm going to take a quick short break and come back and conclude this discussion on what are the three things which will make this incident and this movement a watershed moment for change which we really require to make our public health spaces safer for women. Stay with us. Welcome back. On the Urban Agenda today, we are highlighting the desperate lacunas in India's public healthcare system and the safety of medical fraternity in public hospitals, which are mostly concentrated in urban cities. And we have with us Dr RV Asokan and Dr Sabine Kapasi. Dr Asokan, as IMA, what are the three changes that you think the government can do immediately? Center and then state.
You started the dialogue correctly. That the investment in health is poor. There is just no money there to provide security across the country. So there is no further things are being done. So the security and safety protocols have to be in place by mandatory by a law. There has to be a safe zone declaration, and these are the things which the hospitals are entitled. Otherwise, you don't get a license. So the main issues seem to be in the government sector and the private sector in the medical colleges. Tertiary hospitals in the private sector have a security protocol, but the small and medium hospitals across the country are vulnerable. Small clinics are vulnerable. So that has to be defined. And the third thing, a deterrent law has to be in place.
All right. Dr. Kapasi?
This use of technology as a deterrent for the safety and security within starting with hospital workplaces, but also otherwise as extension to the law and order ecosystem, which can help in moving these decisions as well as these tasks quickly, and then extension of that across workplaces where women feel unsafe across the country. Today, we have 151 sitting MPs and MLAs who have reported cases that they were perpetrators in crime against women. I believe we do need to start a larger dialogue where leaders within our political and social ecosystem should be also held accountable so that the deterrence is not just from the legal fraternity but also from a moral and ethical social place that we need to bring it about. So I think these three things are extremely necessary.
Absolutely. Lovely conclusions. Let's just hope that some of these we get to see rather quickly, and the task force that's been constituted by the Supreme Court actually comes up with similar suggestions, recommendations, and of course budgets for implementation do go up. Thank you both for joining me. And of course, before I conclude, I just want to run our audience through these findings on state of healthcare in India. Now, this was a government self-assessment reviewed over 2 lakh public health facilities across India, conducted through the National Quality Assurance Standards, which is an NQAS program. And what did they find? That our hospitals are extremely substandard in quality. A significant portion of India's public health infrastructure was found lacking in basic standards. So here we are talking about security and CCTV cameras, but overall, there is so much missing in that public healthcare system, and it stems from the fact that we only spend 1.1%, 1.2% of our GDP on public healthcare. And this number seems to be shrinking in a growing economy, as Dr. Asokan pointed out. Now, approximately 80% of public health facilities did not meet the required norms for infrastructure, manpower, and equipment. So, also manpower. So, the medical fraternity is also overworked. So that's another aspect. I mean, this horrific incident in Kolkata happened simply because it was a 36-hour shift. Not to say that these long shifts are not common, but you know, it was a 36-hour shift and the lady doctor had gone to take rest in the middle of the night without any kind of CCTV camera footage to be captured to bring the perpetrators to task. Now, the report highlighted the urgent need for reform in India's healthcare sector. This was released in mid-June, and the government did initiate a plan to bring 70,000 facilities up to the public health standards within 100 days, backed by inspections and funding under National Health Mission. These 100 days, I'm talking about mid-June, are almost over. That's what we have to end with, remembering that, look, all of these things are spoken about, but where is the action? And this time, we really need to see traction on these reforms that were promised in June 2024. And this should be the watershed moment to overhaul India's public healthcare system, focusing both on enhanced infrastructure and safety of medical fraternity. Thank you so much for joining me, and goodbye.